Wow. Thank you, everybody. So John summarized with a question to everybody. I'd like to hear your comments on what's been presented and your suggestions about what you think an organization like Dementia Alliance International could do. Or do you think we've covered it all, or like some feedback? So what you can do is you can either type into the chat box, which is at the bottom of the screen. We have 34 people here today. We could try having a dialogue. Sometimes that works, sometimes not. If you are having trouble typing into the box, then by all means, speak out. But let's just kind of see how this goes. Oh. Any questions for the group, comments?
Yes, my name is George Waters. Again, I can't get onto the internet for some reason to connect, but and I'm a new person of interest to this group. I have had dementia for a few years now, and relatively recent diagnosis of Alzheimer's in combination with that. But I have a long history of advocating and involvement with what we call in the United States are the consumer movement, which means the movement of people who have a various types of severe disabilities to control themselves and their own destiny. I began that as a child when my father used me as his assistant to help him become able to work after several strokes and polio. But and then I was a founder of a thing called the Center for Independent Living in Berkeley, California, which became the first independent living center in the United States, funded by the U.S. federal government. There are now about 1,200 of those, and I believe that I can help contribute a lot in the way of strategies to assist this group internationally, and I hope to become included as an active member of this group. In this country, the United States, I have testified all the way up to the U.S. Supreme Court level in written legislation which has been effective to assist people with various types of severe disability. And now I happen to be one of those people as well, as are the wonderful people who have been sharing today.
Thank you, George. I just want to point out that if you go to the website, dementiaallianceinternational.org, there is a membership link on the main menu. And if you click on there, we just ask a couple of brief questions, and then that will get you onto the mailing list. Membership is pretty informal right now, but at least you'll be in the loop with what's going on. Elva has a great...
I tried to do that, but was unable. I'll work on it again later.
Okay, great. Elva asks, how would donations be used if the organization... Okay, back up a little bit. Dementia Alliance International likes to start on the path of becoming a nonprofit, which is a 50, in the States it's called a 501c3, which means that it can accept donations and provide receipts for those donations to donors. Elvis says, I'm totally on board with donations being used for the benefit of those with a diagnosis versus used for cure research and bloated salaries of other associations. But I'm interested in how funds would be used. Attend conferences, paid staff, set up organizational structure, etc. Any comments from the board on that?
Yes, it's currently our plan that there would be one paid staff person starting out with Dementia Alliance International, and that would be Laura, who has volunteered her time up until this point and will continue to volunteer until we have the financing to be able to afford to pay a salary to her. it's important to us to have that leadership and guidance as we move forward in this process of developing this organization. And without funding, we would not be able to go to conferences. We've worked very hard to get to the international conference this year. We intend to take more people next year. So the funds are going to benefit the people with dementia who are living with it. My name here is Simon, and that's one thing, and it's very important. But it is very important to me to be able to have a quality of life actually having dementia now, because there's not going to be a cure found in my lifetime. So the time that I do have left spent here on earth, I want to be purposeful. And that's how I see our funds being spent.
Go right there. Go right there.
If anybody's dog is like barking or howling in the background, would you just maybe mute your yeah. So who is that?
Dog in the back.
Come on, put your hand up. No one's owning up.
No, it's Sid. Somehow my mic got unmuted.
Okay, I'm muting you. Bye. No, you didn't. Okay. Okay.
Get rid of the dog.
We got it. I'm really sorry, Jan.
Oh, that's all right.
I think it's safe to say that we've all had discussions about how funds should be used, and it's not in the proportion that's used for administrative purposes. We would dearly love to be able to pour resources into developing resources, as Jan spoke to briefly. Amy says, I would ask that DAI assist on a grassroots level in communities, i.e. assist with representing us in our issues and in our communities. That sounds like advocacy. Kate, can you speak to what Amy's asking? And maybe Amy, if you want to expand a little bit on what you mean.
I guess I'm looking for help in that I feel all alone in attempting to represent that we need a voice here. And it's become, I am on our board about the Alzheimer's Association, for example. And as many of you know, I'm really fighting that, and it's become kind of about me and not about what I'm saying. If any of you have had that experience, it's become, well, Amy's the, and you know, what I'm trying to say is, it's more about myself than what I'm saying. So I need more voices just to make people understand basically what Richard said.
Well, Amy, I want to help you with that, and I'm in your community. And hopefully we can work together. As you know, we're trying to get started a cafe experience. And I think we just need to work together as well as we can.
Thank you, George.
Kate, how do you think, I know that we talk about support and advocacy of buying for people with dementia. How do you envision us eventually being able to support people and advocating in their communities?
Gee, hard question, Laura.
I know, it's hard to do.
I suppose that through role modelling that we are all capable of speaking out and speaking up for ourselves. We need to empower each other and enable each other to be brave enough to stand up and speak out for what we need and want. I guess I was lucky that in Australia we've had a very receptive CEO of our Alzheimer's Association, Mr. Glenn Rees, and he's had the vision to support a national group of people with dementia, and we seek to influence policy and assist Alzheimer's Australia to ensure that the voice of people with dementia is being heard. But to get that to happen at the grassroots level, that takes a lot of commitment by sometimes one or two people, Amy. And it sounds like you're the one person in your area. Somehow you've got to network with people in your own areas, I think. Richard, do you want to add anything to that?
Yeah, and Steve does too, actually.
Well, I just wanted to say that everyone associated with Dementia Alliance International knows that I'm moving this weekend up to Wisconsin. I've laid the foundation here in North Carolina, and I've got 7 or 8 or 9 different gentlemen and women that are diagnosed that are advocating here. I'm going to go and do the same thing up in Wisconsin that I started here. Amy, my goal, my personal goal with this organization is to come to you and meet with your association and do what we can to help you. That is my personal goal. That's what we need the funding for, so we can come together and we can band together and I hate to use the term start a movement because that's not what it is, but we want to come together and we want people to understand that, hey, we're significant and we want them to listen to us. And that's what's going to happen. And we've talked about this before. You got to keep speaking out. You got to keep speaking your mind. They hear you. Sooner or later, they're going to listen. It's just a matter of hitting the right ear at the right time to get them to listen. But keep doing what you're doing because you're advocating for all of us when you're speaking. You may say that you feel like you're speaking about Amy, but you're not. You're reaching out to them for every one of us that's diagnosed every time you open your mouth. You've got to understand there's a bigger picture, and you are a part of that bigger picture every time you speak.
Thank you, Steve.
Mm-hmm. Yeah, Michael?
I think many of you know me. I'm Mike Wellenbogen, and there's 2 things that I have with this. First of all, I'd like...
I don't have one in here. So.
Okay, thank you.
I'd like to find out, I guess, if I could be a part of your group. And second, as many of you know, I do a lot of advocacy already, and I do a lot of traveling on the behalf of my own self, trying to, I guess, promote awareness for this particular cause. I do a lot of traveling, like going to Washington, D.C. and other places to make awareness to federal governments and things. Is there an avenue that people like myself can become somehow funded for doing what I'm doing to help out with this cause? Because it's becoming a burden for people like me to continue doing what I'm doing because it's all been coming out of my own pocket. As you all know, it's not an easy thing to do.
Yeah, I'm in that same boat, Michael.
Yep. Yeah,
and we certainly hope that we can grow to a point where we are able to do that kind of thing. Michael, support people in their advocacy. Definitely. We're not there right now, but we hope to get there.
And one of the things that we did mention is that we want people to be able to go out and speak. That is a goal that we have. That's one of our views for the future, is to see people going out and speaking. And of course, we want to be able to support that. So as a member of DAI, we would look at that and make decisions based on its merit and credibility.
We currently have a membership link on the website, but it has occurred to me that we need to add a place where you can list what particular skills or experiences you have to offer, so that we have a mechanism to call upon you when projects start to be developed. And I envision the organization starting to do that, to actually get into projects to develop. Again, how we're going to fund them, I have no clue yet. That's a huge issue, but we do, so far we've been able to do everything we do on very minimal amounts of money. But that way, when we start to develop projects such as a speakers bureau, materials to build capacity and people to advocate and the such, that we can call upon you to bring you into that project. So Michael, what I suggest is you go to the website and just click on that membership button and fill out your name so that we have you, and we will call upon you. Mary Beth had asked if there was a brochure, or no, if there were going to be any speakers from the organization at the ADI conference in Puerto Rico. Who would like to speak to that?
It's Kate here. I'm speaking 2 or 3 times at ADI in Puerto Rico, Mary Beth, but not specifically about this group.
And Richard, Laura and I are doing a presentation about online support groups.
Yeah.
Well, congratulations. I think you guys are doing a bang-up job, and look forward to being involved in this particular organization.
Richard, are you doing a session on stigma as well?
Yeah.
Yes. What happened to me was I applied one night to speak at 3 different sessions. And then the next night, I forgot that I had applied the night before. So I applied for 3 more sessions. I'm going to end up speaking 6 times at the conference.
No.
And various topics related to my experience with dementia. So we will be well represented. It's sad that it's so relatively easy to speak there, but that's only because so relatively few people with dementia go to the conference.
Yeah.
Well, I'm pleased to say that at the conference this year, we will have Kate and Richard, and also Jan and John, and Sid will be there as well, and Sue is going to be there. There's another person coming from Canada who we don't know yet. They're not associated with us currently. And there's also somebody from Argentina who's going to be speaking in Spanish.
Right.
And a lady from Scotland who'll be chairing a session. So I've lost count there, but I think we're up to about 8 or 10 people at the conference with dementia. So that's not bad, I guess, and possibly some local people from Puerto Rico as well.
I think that's really rather outstanding, considering that we've made up 2% of the conference attendance for the last 3 years.
Mm-hmm. And the good thing to let you know is that for the ADI 2015 conference, there is going to be a different style of presentation submission. You're not going to have to do it through the website. It's going to be able to be done via email. So that'll make it easier for people with dementia to submit an abstract.
Good. That'll be good. Yeah, I think one of the issues is that people with dementia don't know about the conference. They don't know that we're welcome at the conference. It's not general knowledge. So that is one thing that we're trying to get out there. I want to mention that just to speak to Amy's question as well about advocacy, that Kate's husband has been helping us hugely with graphic design and creation of materials. And he and Kate and the group are working on a brochure. Yes, everybody, that's your next task, is a brochure about the organization, which will be used to hand out at the conference. And we'll make those available after the conference for people to order and to have. We really envision people taking this material, for example, to their local Alzheimer's Association and or to their local early stage support groups and handing it out and putting people in contact with us so that we can spread the word.
And into the doctors' rooms as well, Laura.
Doctors' rooms as well, that's right. That's right. Yeah, doctors' rooms. Perhaps diagnosis centers, the special memory centers, and
yeah, the memory clinics.
Yeah, memory clinics. That's right, lots of places.
Well, many of us, I believe, think globally. Most of us have learned from a hard life of experience that acting locally is really what counts. That's what makes a difference. And I think most of us are one life.
I'm on a call.
Sorry, I don't know who that is.
It's okay, probably it's okay, thanks.
Sorry, Richard.
That's okay.
Okay, sorry, Richard. Do you want to try that again? You were fading there a bit.
Oh, I was saying that while many of us are global thinkers, think of the big picture, most of us have either been beaten down by experience trying to change large organizations, and we now focus on acting locally. And I've come to realize that really my purpose in being an advocate is to support individuals, not support organizations or states or countries or larger organizations. It's to change people's lives one at a time and let them change other people's lives one at a time. And I think many of us would agree with that.
Yeah, absolutely.
Getting suggestions about where to put the brochure. That's great. We're also printing T-shirts as well for the conference. And the reason for that is just to get to have the people with dementia recognized at the conference by more than a little name badge in a way that they choose. So the T-shirts are pretty cool. So I've insisted on T-shirts for the rest of us who don't have dementia to wear. And I hope that is, I think Arle's design looks pretty cool, so I'm excited about that. So I encourage you again to go to the website, Dementia Alliance International.org, and click on the membership link. And when I send out the follow-up email out to everybody who is on this call, it will include the link to that page.
If any of you have heard any of us say something that resonates with you, why, we all welcome you to contact us directly. We don't have all of our emails online, but you can write to Laura or myself. We are on the website, I believe, our email. We'd be glad to pass along your question or your observation or your comment to whoever it was that spoke today, so that you can directly communicate with them.
I just want to add too that I'd like everybody to try and understand that we're trying to make this all inclusive. We're not, that is our goal, is to make this inclusive for, of, and by people with dementia. And we really want you to understand that you know, that's what we're all about.
Mm-hmm. Mm-hmm. Does anybody have any questions for the group? Yeah, Jeannie Lee?
I just have a comment. I'm so proud of the people that started this, and having been a little bit where you are when we started DASN, it's just a lot of work, but it's so very rewarding, and you're really on a good trip.
Thank you, Jean.
Yes, thank you. Somebody.
Pat Falbo, you typed in that you had spoken to the Junior League. You were asked to speak. Did you go and speak to them?
Yes, I did speak with the Junior League, and it went over fairly well. I was nervous at the beginning, but I appreciate it. In fact, I have another cohort, another person with Alzheimer's. We're in the same group, Alzheimer's group, and one of the radio people asked if, you know, 2 people would come and share their views on Alzheimer's. And so we were selected. Her name is Ellen and I'm Pat. And so we went and we talked, and that was refreshing, quite honestly. And I go to other Alzheimer's groups because some of them are do dancing or things like that. So some are more like joyful, not really business-like. So I kind of go split between the two because I don't want to be all business at the same time.
How did the Junior League find out about you?
I'm not really too sure. I was a professor of mathematics at Lone Star College, and someone might have mentioned my name or something to them. Because I did go to a Junior League thing years before, but I'm not really sure how that came about. But I know that it was interesting and they liked it, and it was a pretty good group. It was like a breakfast thing and everything. So, and then when I teach at a local college, I used to teach mathematics. So right now, instead of teaching, because of the Alzheimer's, I'm volunteer at the library at the same college, and that's really been a godsend for me because I can see people I know, and people know I have Alzheimer's, and I know nobody embarrasses me or thinks, oh, she has Alzheimer's. I'm just really kind of lucky on that. But I think it's because I gathered into a group. And, so I don't know if there's anything else about that.
That's great. That's great.
I tell others how good it feels when I'm in a room with other people with dementia. And for most people who don't have dementia, they can't imagine feeling good sitting in a room full of people with Alzheimer's. It's scary. But there is a connection just when I know that everyone in the room have dementia. Just when I listen to them talk and sit next to them, that you don't get sitting in a room full of professionals or caregivers or anyone else other than people living with the symptoms of dementia. And I invite you all to make that happen in your lives. Call up your local Alzheimer's Society and ask that they form a group of people with dementia, because most of them have so many groups for caregivers and so few groups for people with dementia.
Mm-hmm.
And believe it or not, it's because it's never dawned on them that we're really interested in getting together with each other.
Mm-hmm.
And then so often when they do put us together, they think they have to have little busy work projects instead of letting us talk to each other.
Yeah. Bring in a professional to fix us rather than allow us to be ourselves with each other.
I don't know who that gentleman that just said about some of the meetings of Alzheimer's are like, they're not, I'd like to know more information sometimes more than like making a drawing or things of that sort.
I want to smack my head against the table every time I hear somebody talk about these support
groups. Me too, Laura.
Yeah. Yeah, somebody a long time ago in this country decided that on people living with dementia side of these support groups that they should give us little busy work projects, and that's how to deal with the people instead of talking about things and learning from each other and feeling support. I just don't even begin to understand what they were thinking about. I don't know.
I agree with you.
Let's all draw a clock.
Yeah.
That's the test that got you in the group of the Richard.
It has to flow down from the prescribed disengagement that we're dished out when we're diagnosed, surely. We're told to give up our life the day we're diagnosed.
Yeah.
I think the busy work is very clearly making us children. It just, it helps us be non-people if we're children because they're caring for us. I am really lucky. I work at an adult day center, and I spend Fridays with about 60 people. I'm guessing half of whom have dementia, from my age, 56, all the way up to I was playing around with a 101-year-old man,
Wow.
joking around with him. So I really enjoy my work there because I just sit down and chat with people.
Does that make you a cougar?
Yeah, Alpha, you just made the point. It's been said several times in meetings, support group meetings and board meetings, that when people think of people with Alzheimer's or other forms of dementia, that they automatically go to the end stage, and that's assumed. And Kate used the term prescribed disengagement. It's like with the diagnosis of dementia, everything changes. It doesn't matter what the world was like 5 minutes before that. It's with that diagnosis, everything changes, and the whole perception of that person changes. And it's one of the reasons that our vision has to do with continuing to be fully valued. Perhaps the word fully needs to be emphasized. That there's not a diminishment in value as soon as that diagnosis takes place. So one thing that the group wants to work towards is to change that perception, that you should not jump to the end stage.
Everybody wants to see us by what we can't do rather than what we can do.
Right.
Everybody wants to measure what we've lost the ability to do than what we have the ability to do. So pretty soon we agree with everybody that we're half empty and that we're just getting emptier and emptier. And that's just back-ass words.
Yeah, well, you have to rise above that.
Yes, that's
right. Well, and the associations and societies for fundraising push you to tell a sad story to elicit donations.
That's right.
And if you don't forget a word or two while you're saying it, they don't think you have Alzheimer's.
Yeah, right. You can't sound too intelligent.
It's not just about a sad story though. It's total lack of education.
Yeah.
A lot of the media and people out there, even the medical profession, pretend to ignore us because they don't know we exist. It's all about education. People need educating.
It's very sad when people say, my mother's gone. She's not, she's not there anymore for me. I've seen a lot of posts like that, and I usually try and go in and say, no, your mother's your mother.
We're still here.
Yeah, Glenn Campbell daughter stood in front of Congress and said her father was gone, sitting right there beside
Oh my God.
her. And I thought, oh no.
I've lost count of the amount of carers forums that I've been banned off for speaking out about what's going on and about educating them.
Don't stop speaking, Chris.
Oh, I won't.
I think Pat Cohen, did you want to talk?
Yes.
I'm a caregiver and a professional and work in a healthcare system. I hate to admit that out loud to this group.
Oh no, you're fine.
But one of the things that I feel, and I said this in the chat, you all inspire me tremendously. But I think one of the things that I think is important for you all to realize is that you're groundbreaking territory here. Physicians, nurses, people that have been caregivers, listening to all the stuff that the Alzheimer's associations put out, are doing exactly what Laura said before. They hear Alzheimer's, they see end stage, and you have to become that new face. And it's really hard to get that message across. But I know a couple of years ago, we at Advocate, which is where I work, had a forum for professionals, and we had physicians and caregivers and all kinds of speakers. But one of the speakers that we had was a person with Alzheimer's. And across the board, the comments from the group were they had no idea that people with Alzheimer's looked like this person did. And I think it's sometimes hard to realize that that's not the common perception, and that you are the groundbreakers and the baby boomers, and just calling yourself activists and advocates. That's a brand new thing. I've been in adult daycare and working since 1980, you are the first group of people speaking up and saying, I have Alzheimer's, listen to me, because that was something that people have not said before.
Mm-hmm.
Yeah.
And we're proud to do it.
Yep.
Yeah, and Pat, I'd like to say thank you for listening to us.
Yes.
Oh, I really have enjoyed this. Is Pat Falbo. I really have enjoyed this and want to continue.
Well, Pat, you might want to consider joining one of the support groups if you don't have a support group locally, especially.
Oh, I am in actually about 2 of them.
Oh, in my one, okay. Yeah, Pat. No, you're right. The network is growing slowly, and I see this. We had a big struggle when we first started talking, and I can't believe it was only 3 months ago, after a memory cafe, that we started talking about this. And the struggle was, do we start locally and build up, or do we start globally and network down? We chose the globally, and I can already see that even with just a few people that we know in Canada, for example, that if we just had a few more in a network who are willing to be advocates, that because Canada does not have a national working group of people with dementia, that we just declare our own. And maybe that will happen in other countries as well. And then from there, if we get provincial representation on this group, then they can start being advocates for each province. And then it'll network down, hopefully, to the cities. And it might take a few years. It probably will take a few years. But I think that's how I can kind of see it reaching out into the communities. And it slowly will change that perception, and we'll have more people with dementia who are speaking at conferences. And Mary Beth, you are speaking at a Changing Melody conference as well. And, yeah. And so we, as you can see, we have a few people here who have spoken or who will be speaking.
Yeah, I'm quite excited about that, and I'm hoping to kind of turn people upside down, shake them, and say, you know, let's rock. It's time to stand up and be advocates, and that's what my main focus of my speech is advocacy for those with dementia. And then another one that I've been invited to is some kind of a geriatric speech, and that's in December in Toronto. So I think for us in our particular area, which is Kitchener-Waterloo, Ontario, things are breaking down, and I've seen that just over the 1.5 years since my diagnosis. So things are changing, and I'm really, really excited.
What kind of changes do you see, Mary Beth?
I see smaller groups starting to connect with each other. I think technology, which you guys have really keyed in on, has helped that. So when you're entering into, for instance, the Alzheimer's Society, it's easier to connect with people in my particular area. And I think the strength of the Alzheimer's Society in this region has been excellent for pushing to have people with dementia stand up and advocate for themselves. And then the second organization that's been instrumental in our area is one you may be familiar with, which is MAYRIP. And that's coming from the University of Waterloo. And I see all kinds of opportunities to have MAYRIP liaison with this group and support them. I think there's just going to be some really cool stuff coming out.
Yeah, I agree.
Yeah.
Agree.
Yes, they are a very enlightened group of people. MAYRAP is way out ahead of themselves.
Yeah.
And I would encourage you all to go look at their website too.
Actually, I have spoken with Lisa Lucelle, who's the director there, and about her involvement with the Circle of Friends, and she's ready for it. So whenever the Circle of Friends sits down and starts to talk about particular projects, she's already waiting to be involved.
Excellent.
Yeah.
Oh, that's great. She's so busy.
Yeah, that's awesome.
I don't know how she's going to do it, but We'll
So
make
it's
it work.
MARIP, M-A-Y-R-I-P?
M-A-R-E-P.
M-A-R-E-P.
Yeah, it stands for Murray Alzheimer's Research and Education Program.
Yeah. Big
Lisa,
advocates.
yeah, Lisa Lizelle is the acting director. She will be at the ADI conference.
Mm.
So
If-
we'll have a chance to meet her there.
Yeah, and
Laura?
I would strongly encourage that if you have yet to shake her hand. She's
Yeah.
really, she's a lot like you, Laura. She's a real advocate for those with dementia and believes so truly in a partnership approach.
Yes, they've been groundbreaking in that. They really have. Yeah.
Yeah.
Kate?
I was going to answer Phil's question, Laura.
Oh, yes.
Which how to communicate this group to the Alzheimer's associations in your areas. What I did in Australia was I sent the newsletter to our CEO and senior people in our national association, and then they sent it around to all of their networks, national, and then asked each CEO of each state of Australia to circulate it amongst their state networks. So that was one way of at least getting it out there.
Mm-hmm. Dina?
Oh, I just wanted to ask if the organization that Mary Beth mentioned could be given later in an email or something.
Sure.
Thank you.
Oh, no.
Yeah. Laura, do you want me to get that to you?
Oh, I have it. Thanks, Mary Beth. I'll send it off to Dina. Yep.
Thank you.
And in fact, I should just have them on one of the webinars. They do so much work. Mary Beth was in a video that they recently produced as well in Canada.
Ah.
Yeah.
Phil, to answer your question as well, I think once we have the brochures, that we'll be able to forward those out to people who request them to give to their local Alzheimer's associations. I think it'll be important to list in there what DAI can do to the audiences, do for the audiences that might be reading that brochure. Something also that John Sandblom did not too long ago that was quite successful in his early stage support group was to print up cards. And he did it himself on his own home printer and printed them off and handed them out at his support group. That's a model that we will probably follow either with a brochure or business cards of some sort. They're personalized. They had John's name and picture on it. They had his email address. It had the link to the website, talked about the support groups and what the organization can do, and it was just on a nice little card. So there's different things that we're working on. And you know, it maybe people have to try and get a meeting with their local Alzheimer's Association chapter and just talk about the group and maybe try and get invited to be a speaker for something, and maybe just ask if they could review the services offered by that local chapter to people with dementia and offer suggestions. Steve,
we have to be very careful how we approach this, because we do not want them to think that we are in conflict with anything that they're doing. We want to reach out to them and let them know that we want to work with them in any aspect that we can, but we are more centered towards the patient diagnosed rather than the caregivers. But we want to be very careful that we don't offend them in any which way, because we want to work with them. We've talked about different ideas that I have to work with them on, and that's what we need to do. And I just wanted to throw that out.
John?
I think it's important to get to the young people coming out in the medical field, the new ones.
Yeah.
Because you're skipping, I mean, just some of our generation that are out there will change, but for them to understand, and a lot of them are dealing with parents with it, and to try and, you know, that's an important point too.
Great. John, you wanted to say something?
Oh no, I totally echo what Steve just said. We're not out to compete with any of the organizations already out there, or societies, associations, whatever. We're trying to fill a gap of uniting people living with dementia, which really isn't being done right now. You know, there's not any emphasis to make a community out of us. And we learn a lot from each other, and it bolsters how we feel to connect with each other. So it's just incredibly important.
We are a very unique group. I'm aware of DASNY being around earlier and being for people with dementia, but so much has changed in the meantime, and we have so much work ahead of us to do. And now we have the social media to help us get that word out and to be able to stabilize and form a long-lasting organization.
No doubt that we're swimming uphill when we go and approach our local Alzheimer's associations, because honest to God, they should have been doing this by themselves, and they're not.
Amen.
A little defensive about it when you walk in the room. And their purpose in life is not to make our lives easier, it's to perpetuate themselves and to cure Alzheimer's. And unfortunately, that's not our purpose. Our purpose is to find quality in our lives, and we turn to them to help us with that. So note that I said please 4 times when I was in the Alzheimer's Association.
Yeah.
Yes, we have to tread there lightly and understand that it isn't because they don't know about us that they don't lead us. It's because they don't understand us. They don't appreciate us. They don't have us around their offices. They don't have us on their boards of directors. They don't pay any of us anything to do anything. So the more we can just brush up against them, I think, as a first step towards showing that we don't have horns and we don't want to take their jobs and we don't want to take their money or their glory. We just want them to serve the people in whose names they are raising money and creating glory. I think the better off we'll be.
I did get a couple of letters for going to help them with their breakfast. I've never asked, I don't think, anyone before who was demented, and they were pleased by it. A lot, the information thanked me for, having a different perspective, and I think they'll probably do more of that now, I hope.
And they are individuals, they're not an organization. They have a pretty strong culture, it's true. Yeah. But they still are individuals. And many of those individuals are there because they care about Alzheimer's. They've had somebody in their family who had Alzheimer's, or they've had some personal experience with it. So we just have to get up close and personal with them and remind them of why they're really there.
Right.
Richard, that is so true, to break them down individually. I've just encountered, and I am on our board at Alzheimer's, that they, nice people, but what they really want to do, and it's really all of them, I'm not generalizing, is go to lunch and feel good about this themselves. And we do have a couple people there for their resumes that do nothing, but they can certainly put it on their grant that they attend via the phone while they're having their lunch. I am featured at our gala. I've told you all about my gala, and I'm on the billboards, and there's going to be 400 people there, and I will be speaking. So it's still because I'm telling my story, back to the story thing. So I have to make them feel good about themselves with my story.
Any chance of you going rogue, Amy, during your speech?
I'm sure they're afraid. They are very afraid. Yeah. They excluded me in their year-long leadership conference that they are having, and they're not having anyone there with people with dementia, and so they're not happy with me right now at all.
Get along
We are.
and go to all your billboards and start writing graffiti all over them.
Yeah,
And now I'll proudly say that Amy is one of our Circle of Friends members. So it may be a DAI interview that she does.
Okay, well, you guys are my only friends now, so I'm glad being there.
Yeah, Mary Beth is suggesting letters to the local newspapers. Do you mean letters about dementia, or about what exact topic maybe?
Well, I think for the person who is just speaking, where she might go rogue on us, you know, is the local community aware that the Alzheimer's Society is basically eliminating her from involvement? And, you know, it could be quite a nice, spicy letter to an editor.
I write letters because I'm an ambassador, and truthfully, they're written for me. To the letters of trying to get the HOPE Act signed by my congresswoman. So I kind of play that role. I'm just this person out there that they can say, see, Amy's there. See her picture?
And understand that most of these people, it's not that they don't believe they don't know us. So when you pop up and say, well, I'm different from everybody, they don't know you. They know in their minds their grandmother who was 87 and died of Alzheimer's, and that's the last memories they have of her. Mm-hmm. And I thought that when I spoke up, that once they saw me, well, then it would be over, you know, then they'd know me and they'd know all of us. That's not the case. You got to go back and back and back and back. Mm-hmm. And you got to get more and more people to go with you. That's how it works.
Yeah, and Richard, the problem with just a few of us speaking out is as soon as we do, people say, well, you haven't got dementia because you're speaking out. So the more of us that do that, the more, sooner we'll break that down.
Yeah, so true.
Everybody go out and find 5 people that you know who have dementia. That would give us a lot. I can't do the math. And if they would find 5 more people, we would have the start of a movement going.
Yeah.
That's how this is going to take off.
Well, and my dream is to have a bunch of us with dementia to just travel around. The board members hear me say this all the time, but that's my dream, is to in numbers to travel around and talk to people and show them that we
our traveling rock show.
Yeah.
So Alpha, you were asking, what's a specific example of something that could be funded, a project that we would organize and undertake? Dina's road trip is a perfect example. That could cross North America.
On a motorbike.
No.
I just warn you, Laura, I pack large.
Oh, no. I'm sharing a room with you, Jen. You're scaring me.
Well, I guess in our city, or in our province, they've just announced a big new department and deputy minister and a bunch of money for seniors. So I want to go. This woman is got the job because she's the largest caregiver owner of big caregiver things. You know, kind of. There's a lot of them under her. So I'm going to try and get into her because she said she's going to listen to everybody before she does everything. So I'm going to try and get into her and say, well, you know, you're going to have issues and money for Alzheimer's and all that in there, and dementia, right? What about people like me who tried to get help but I was 1 year not a senior, because there's a law that you're not a senior here in getting anything until you're 25. Yeah. So what are you going to do with the person who's 24 or 23 who has dementia?
Do you mean 65 or 64?
I mean 60, sorry.
Yeah, okay.
65. Sorry.
Laura?
64.
Can I just, I think it was Richard who mentioned the word dementia movement. In my speech, which will be in about a month from here, and I literally have just finished a big draft of it, I use the word dementia movement. And, you know, to quote Bob Dylan, the times they are changing. And I use this group as part of the base on why we are now in a dementia movement. And I have examples of, you know, the women's suffrage and all those other types. We're here. We're part of it. We're at the beginning of it. And now it's the time to get those other members all rolled up and continue on with that rolling stone effect. But we are in a dementia movement. For sure.
This is it.
This is it. And one of the things when I looked it up on Wikipedia, there's a whole long list of dementia or movements, all kinds of different examples. But there isn't one that says dementia movement. That's what we got to change right there. Just a thought.
Yeah. Where did you say there's a list of movements or something? I was typing in a message.
Wikipedia.
Oh.
So if you do movements in your query, it will come up with a long list.
So we need to add ourselves to Wikipedia.
Yes.
Right, okay.
Yeah, we have to get on that list saying that we are a movement now.
Okay. Okay, that's a good idea. Well, everybody, I think it's about time to wrap up. I want to thank everybody for being here. Elva had asked about videos. Yeah, I think, Dina, you're right. I think a more informal video would be great. We do have the video that that you did for fundraising. It's on the donate page of the website. There are also the To Whom I May Concern videos, which you can access off of the mindsmeeting.website. It's obvious we need a YouTube channel and we need to put all those links together. So we have some work to do. And we have a Facebook page as well. And if you go to the website, you can click on the Facebook icon and go there. So any other last comments before we close?
Sorry.
Just very, very, very happy for the people that came and very proud of the group.
Yeah, likewise.
Yeah, me too.
Thank you.
I agree.
Mm-mm.
Yeah. Yeah, I agree.
Okay.
I look forward to working with everybody in the future.
Yeah.
Okay.
Me
Bye,
too. I'm so
everyone.
glad to get this chance to get inspired by you.
I look forward to it as well.
Yeah.
Remember, tell 5 people you know with dementia.
Right. Yeah.
Okay,
Okay.
we will. All right. Thank
I
you.
apologize for messing it
Next
up.
month. Okay. Thank you.
Yeah. Okay. Bye, everyone. Thanks so much.
Bye.
Thank
Bye.
you. Bye.
Bye.